A quick preamble: 30 years ago, the International Conference on Population and Development, ICPD, set out to achieve a world in which people lived longer, healthier lives and enjoyed more rights and choices than ever before. This vision has become a reality for many. In fact, the human population is at its highest number ever, thanks in large part to the improvements in healthcare and increased longevity. Yet, as we celebrate the progress that has been made, we must also recognize that for millions or even billions of others, this promise remains out of reach. Realizing sexual and reproductive health rights for all is the foundation for gender equality, dignity and opportunity. We shall be joined shortly by His Eminence Sheikh Ali Muhammad Waiso, the Deputy Mufti of the Uganda Muslim Supreme Council, for perspective on what is being done, especially in terms of collaboration with religious leaders in tackling the growing challenges on our population. But our discussion will begin right away with Jackie Katana, a sexual reproductive health advocate who has many hats. She's executive director and founder for Faith for Family Initiative and also a representative at the Health Policy Advisory Committee of the Ministry of Health. At global level, she represents CSOs on the Global Fund facility. That one, I think she will be able to give us a little bit more detail on that. Let me just throw it to her in light of tomorrow's commemoration of World Population Day. A very good morning and welcome to the program, Jackie Katana.
Thank you so much.
I was at pains to put together the different hats that you present today. Could you just take us through that?
Thank you so much. Good morning, viewers. I'm Jackie Katana. I'm the founder and executive director, Faith for Family Health Initiative. It's an interfaith NGO with a mandate to improve family health and well-being. I also represent civil society organizations, especially the reproductive health, CSOs, on the Health Policy Advisory Committee of Ministry of Health.
Morning.
I also at global level, I'm an alternate CSO, representative anglophone of the Global Financing Facility Investors Group. This is a group of all the donors that put funds in reproductive health through the Global Financing Facility. Thank you.
Wow, that means there's a lot of intervention that you are championing from across the various positions that you hold. In light of World Population Day tomorrow, what is our main focus this time round, both on the global stage but also at national level?
Thank you so much. In Uganda, clearly our theme, we are looking at prioritizing free education, preventing school dropouts.
That's right.
And the focus for today, improving household income amid this growing, very fast growing population. And as advocates, we are very, very concerned. Annually, we have 3 million growth rate of Ugandans, those who join the race. We're almost hitting 40 million, we are at around 37. Amid these constrained resources, the growing population would not be a challenge.
That's right.
Definitely it would give us more markets, it would give us more labor, but it's because we are constrained economically. Also the revenue base becomes low if you don't have a quality population.
Okay.
So we come in to make sure that we prevent school dropouts so that we have people who continue and complete education. But very important for reproductive health. We look at this theme in terms of education, in terms of improving livelihood in 3 angles. Improve livelihood to ensure that the young girls and women stay in school and we prevent teenage pregnancy.
Okay.
We know that one of the highest challenges, we have over 25% teenage pregnancy rates in Uganda.
25%?
Yes, and that was 8 years ago when we had the Uganda Health Demographic Survey done.
Okay.
We have one that is ongoing, so it could have even increased. We have high mortality rates, and that mortality rate statistics show that the majority of those that have higher child mortality rates are those young girls who give birth before their age.
Okay.
We have sexual gender-based violence. We all know poverty and what it causes to households.
Yeah.
And if we look at education, and it's not only free education, Free education, how does free education help us to retain the students at school? Because education the government of Uganda has provided, but they need to continue scaling up.
That's right.
But their needs, for example, meals, scholastic materials, but for the young women, they have needs like sanitary pads that affect their concentration in school. So even with free education, we need improved livelihood, we need households that have adequate income so that they are able to address other needs, including nutrition, among others.
All right. What I do gather there is that we have a whole litany of challenges that we do grapple with, both at national, at local government, and of course at community level. What I also gather is that there isn't concerted effort, for example, to ensure that aspects like fertility, mortality be brought into, I don't know whether to describe it as equalization, where we have manageable fertility levels, but ensuring that mortality does not overrun in terms of how many people we do lose. In light of the commemoration for World Population Day tomorrow, I don't know whether the theme stays in tandem with the global theme or we have a particular focus as a country.
For this year, it's in tandem in terms of meeting the Sustainable Development Goals and leaving no one behind. But as a country, we looked at our real needs. If we are to address and harness demographic dividends as a country, what is it that we need to address? One, for us to have a transformed society,
that's right,
and to make sure that we leave no one behind, we need to make sure that we have education as one of the pillars of harnessing demographic dividend, a tool that is going to help us have quality education. We need to make sure that we have quality health, and also we need to make sure that we have manageable families. So as a country, we aligned the theme according to our efforts that have been ongoing, and once that is done, then we'll be able to ensure that we have quite a population with income, and then the country will not struggle to have the budget. Domestic resources will not be low, because surely it's pressing the rock. If we don't bring in the revenue, where does the government get the revenue from, apart from the investors and other few resources that we have? So a poor population cannot support the government, cannot support the economy, and that's why we are always struggling with inflation, high debt burden, our GDP, which the index that helps us to look at the growth and development is always fluctuating. And we've not also been in the healthy sector. We've not been able to meet the Abuja Declaration, where the government committed to commit 15% of the resources to health. We always between 50 to 60%, and this year even the health budget has dropped. And even other sectors, education, agriculture, and others. And the reason because we don't have diversified means of getting local revenue. And it all starts with the quality of population and also how, even the markets. Look at the markets. If you don't have people who have good income, even the markets, business will crumble, trade will crumble, even investors will not be able to benefit.
Okay, when you talk about people having good incomes, and then there you have my ear, because I really want to reach a point where I can figure out exactly how everything is going to be in line with the dependence that I have or any other person out there has. But let me bring this into perspective. Population growth is often seen as a precursor for economic development because it provides the numbers, especially in improving human capital. However, the challenges are so enormous to the extent that it is seen as a threat, especially in developing countries. Either because of pressures on urbanization that leads to growth of slums and then fizzles into crime. Those are challenges that are operating well within an atmosphere that should ideally be seen as advantageous. At policy level, I do not know whether we have a blueprint that allows for us to harness the dividends of population growth while effectively ensuring that we do not again pose the kind of problems that too many people can, bring forth. What's the discussion at policy level, government and all the other stakeholders who are intervening?
Yeah, thank you so much. To begin with, when you look at our Vision 2040, and also you look at our National Development Plan 3,
Yeah.
clearly the four pillars or the pillars that we look at for human capital development are well aligned with the targets to achieve in the development plan. But as I said, it gets back to a number of factors, and you hinted on them. One of them that is very core, and I'll repeat it, is financing.
Financing.
You know that
money,
as a country, most of our support to these sectors, to these pillars, is from external support. To already what I alluded to, low local revenue, and as a result, then we cannot be able to finance our budget domestically. But also, we need also to look at the different approaches that we use, all the actors.
That's right. And
again, policies in the health, like the national health policy, helps us to harmonize. And these days, we are aligned to what we are calling a multi-sectoral approach. Because when you're dealing with health, when you're dealing with education, it's not a challenge of only line ministries. It's a challenge or responsibility of other actors, like civil society organizations, religious leaders, cultural leaders, community leaders.
That is right.
So that way, when we have strong structure, strong systems, we'll be able to address that. But also when you get to what we are addressing today, we are working hard. Right now we have the two policies that guide this process. That is the reproductive health and the adolescent health, and they are being harmonized, and we hope to get the strategies and guidelines finalized.
All right, Ms. Jackie Katana, I'm afraid we're going to have to go for a break right now, but when we return, we shall continue with this discussion and also build on the fact that key stakeholders, including religious leaders, ought to have an integral and a frontline role in this. We shall also be hosting His Eminence Sheikh Ali Mohammed Waiswa, Deputy Mufti of the Uganda Muslim Supreme Council, on the show to help us embolden that angle in as far as religious leaders' contributions is concerned. Stay with us, we'll be right back. Welcome back. We're glad you're still with us here on Morning at NTV. The hashtag on Twitter is MorningAtNTV. I am at Chris Higenyi. You can follow so that the conversation can flow further onto our social media platform. Let me return to the studio and introduce His Eminence Sheikh Ali Mohammed Waiswa, the Deputy Mufti at the Uganda Muslim Supreme Council, who is now joining us for this discussion. A very warm welcome, Sheikh.
Good morning, ladies and gentlemen.
Assalamu alaikum.
Wa alaikum salam wa rahmatullah.
All right. I'm also, of course, joined by Jackie Katana, SRHR advocate, who had already talked to us about ongoing interventions, especially when it comes to population struggles and the challenges that the nation is facing. I will return to her shortly, but first, let me give an opportunity to Sheikh Ali Mohammed Waiswa to take us through what you have been tasked with, especially when it comes to your role as religious leaders in the fight against the challenges that population throws at us, but most importantly, how to improve livelihoods of the average Ugandans in terms of income.
Well, first of all, I apologize for coming late.
Perfectly understandable.
It's a symptom of population growth. You see, we had to look into our home first to give ourselves capacity building.
That's right.
In understanding sexual and reproductive health rights. And therefore, we had to engage our clerics to get to understand what the challenge means and how to go about it from the religious perspective.
That's right.
We therefore came out with write-ups based on religious texts that can help the clerics and religious leaders to address sexual and reproductive health rights in the religious perspective, whether in sermon or in casual talks and things like that. So we have tailored messages based on religious texts, which helped us to be able to address the challenge of sexual reproductive health rights and guide the public how to really, address the challenges connected to that aspect. And we have gone a long way. As you know, religious leaders in our structures, we have health centers as well as schools.
That's right.
Therefore, we have equally engaged the public through our health centers and also the schools through engaging the teachers, head teachers, in addressing matters pertaining to sexual reproductive health rights. Yeah.
Okay. And that, of course, speaks of what is a multifaceted approach to the challenges of the day. Reproductive health, when you look at it from the fact that there are aspects that could hinder access to that are entirely religion-based, I do not know how specific you are tackling this particular issue. If you don't mind, you can take us through what exactly is being addressed, especially when it comes to age-appropriate education, because there could be confusion.
Exactly.
Where how do you deal with the teenage question, and how do you deal with the adult or young adults?
Exactly.
That could cause a bit of confusion. How? Just take us through.
Actually, that was a contentious issue. You see, at first, addressing sexual reproductive health was open-ended. We therefore emphasized the need to confine it to age limit in terms of addressing it as per the age requirement.
Okay.
And that was very important to us because when it was left open-ended, you could find that children are being taught things beyond their age, which impacted negatively.
That is right.
Instead of helping them to, to address the challenge. Therefore, we emphasized also the need to address the issue as per age limit. Let's say the young ones, and then the adolescents, and then the adults, not equally the same. We therefore wrote out booklets addressing those different ages as per religious guidance, and it helped quite a lot to bring the issue in a way that religious people could understand the matter.
And everyone be comfortable.
Yeah.
All right. Jackie Katana, in terms of community-based initiatives and what grassroots organizations doing to support the kind of model that religious leaders ought to roll out, I don't know whether you were integral to the formation of that. Did you advise, or have you been taken on board effectively?
Thank you so much.
Yeah.
There are a number of efforts by the different stakeholders. Deputy Mufti's for years has been a national population champion through different stakeholders. But for the last 5 years, Faith for Family Health Initiative came to scale up the model, and we've been training religious leaders as reproductive health and health champions. We called it champion building, and we use the interfaith approach. So with the help of the national champions, I'm sure you've been following, all of them now are supporters and they're advocates for reproductive health, appropriate, as he said, to the different faith. So we've rolled this in over 20 districts, where we have over 200 champions. We do studies and provide evidence and facts, the facts that I was talking about, to package the information. For example, if you don't know how harmful or how beneficial is a growing population, then you'll not see the need. I'll give you an example. When we started talking about family planning, before we did capacity building, some faith believed that we are trying to control nature, and that was against God's will.
Okay.
But when they helped us, they unpacked. And actually, they said, the scripture they use, subdue, means quality. So we are not talking about numbers, where we are saying family planning is 2, 3, 1, but we are saying, can you have children that you can take care of and they are able to acquire the needs that will make them better citizens, so that they don't drop out of school, that you don't leave the household impoverished, and they're able to attain good quality of life.
Okay.
So we've had a number of them, but working with other stakeholders, with support from development partners, civil society organizations, the government of Uganda, and we've seen a shift over time. Yeah.
Okay. Now, when days like World Population Day come into focus, it's an opportunity for nations and all stakeholders to review what works, what doesn't work. Right now, the government has a rollout of PDM, and this question goes to Sheikh Ali Muhammad Waiswa. There is rollout of PDM. This is to ensure that livelihoods improve.
Exactly.
At the household level. Religious leaders are widely seen as the first point of interface with people. They go to churches, they go to mosques, they go to community-based conventions. Have you been factored in this rollout of PDM to the point that you can effectively say you have a role that you're first of all comfortable with, but is also effective in ensuring that the goals are achieved?
Well, we are appreciative of the government intervention programs in regard to elevate poverty through numerous programs that it has come up with.
That's right.
And as religious leaders, we welcomed these interventions, though some of us had a challenge about it, especially from the Islamic perspective, whereby we do not enjoy paying interests. We thought that the program should be curtailed onto Islamic nature of lending and giving back.
That's right.
Without necessarily interest rates or something small like administrative charges. And His Eminence the Mufti of Uganda has been appealing to the government to redress that. But otherwise, as the Inter-Religious Council of Uganda, we have been able to embrace those programs and spread the awareness to the public about the benefits of participating in such programs, and being effective and honest in dealing with those kind of programs which actually government came up with to enable reduce poverty, something which is really good.
Okay.
Yeah.
Partnerships between youth-led organizations, civil society groups and government entities are widely seen as anchors in advocating for increased investment in education and age-appropriate SHR education. Jackie Katana, what is the landscape on this? The youth.
The youth.
How engaged are they?
Yes.
Many are complaining that when some of these policies are rolled out, they are not consulted, they don't know how much money is involved, and they want to be part of it. Yeah.
And when you go back to their slogan, which has worked very well, when the HIV is to talk about meaningful involvement. Now for the youth, they've come up with their own slogan, nothing for them without them. So which means that civil society, development partners, the government of Uganda, all actors should meaningfully engage young people. Like the Deputy Mufti, His Eminence, rightly put it, the needs of the young people evolve over time, and they are very dynamic, very agile. What is their need today might change. But also we know that access to services has been a challenge. Even when you talk about the programs, surely there's a youth empowerment program, but how can they be mainstreamed in other programs? Because economic empowerment is very key. All the challenges that we initially discussed, I always tell people this. Almost 8% out of 10 of young girls who are wooed into early debate, who get teenage pregnancy, 8% out of 10, 8 out of 10 you find it's because of economic needs, which leads to teenage pregnancy and a cycle of poverty and many other challenges. So they are wooed into getting the needs, but also, as I said, studies have shown that even getting sanitary pads and simple things, because their households can't afford. So even when we get free education, we need to involve them into these programs. But very important, and I like that theme because it talks about household. Yeah. When you go into a household, don't pick on the youth. Involve the parents, involve the entire household, so that now that becomes concerted effort.
That's right.
So we are working together with all of them. We call them, actually, we call it joint efforts. And when we are doing engagement, we use approaches like joint advocacy, so that when the religious leaders advocating for the needs of the religious leaders, CSOs, also the young people are able to put to table the needs to the key decision makers.
Okay. Yeah. We don't have a lot of time. We're entering the final bit. Allow me give the remaining 3 minutes to Sheikh Ali Muhammad Waiswa to highlight on any aspect ahead of World Population Day tomorrow that I may have missed as a moderator in this particular interface. Is there anything you would like to wrap up with?
Well, first of all, we thank our partners who have done a great job to support all arrangements, all activities pertaining to sexual reproductive health rights. We thank the President's Office that had come up with the particular initiative to also address this through the Ministry of Education. It has gone a long way to spread the awareness, and we thank the partner organizations, the civil society organizations, the faith-based organizations, that we are all working together to promote this in a proper, amicable way that really help people to understand the nature of the challenge that we are going through. Okay. I also would wish to appeal to the partners to consider other challenges that face us as a community, because at times there raises challenges that are controversial, that seem not to please them, and they pull out their support and things like that. We should not mix up the agenda. Okay. This is an issue and the other is a different issue. We need not to politicize everything, but continue to serve humanity as it requires. And this is very important because it has impacted onto us very much negatively, and I don't think we should go that way.
Okay. Yeah. Thank you very much, Sheikh Ali Muhammad Waiswa, Deputy Mufti of the Uganda Muslim Supreme Council, and many thanks to you too, Jackie Katana, a senior and global advocate for sexual reproductive health rights for the perspective. Just a reminder that national commemorations will be in Alebatong district. That is tomorrow, the 11th of July, World Population Day. There's a lot to take in terms of what is happening as far as policy execution, implementation is concerned, but also highlighting those very challenges that are faced by hundreds and even thousands of youth across the country that could be, well, determining the tilt of population that we have. That will do it for our Kickstarter, improving household incomes in a growing population ahead of World Population Day.